All right, let's go over the Dutch Complete hormone test. This is a urine test. You're going to end up with urine test strips like this that you'll do throughout your day. And you're going to want to put your name, date, data sample on these cards, each one of these cards. You're going to end up with 5 of them. One of them is if you wake up in the middle of the night. You don't have to do that one. But do the other 4 when you wake up right away, 2 hours later, dinner time, and then right before you go to bed. The things we're going to get from this test are profound. They're much different than blood tests, what hormones are circulating in your blood, total levels. They're going to give us critical information of pathways of certain hormones. You'll see that most here on this page of the Dutch test, where you can actually see the total levels. Let's see if this will give you it. You'll see total levels, and you'll see the red arrow right here. We want to see balance, of course, straight up, see balance of the hormone, but these arrows here between are pathways of certain hormones. This whole box right here is androgens. Testosterone, DHEA are types of androgens. And then the other box, all the grays are the types of estrogens, how it's clearing, that sort of thing. Very, very helpful for hormones and seeing what's going on with your hormones. The other part, reason we have you do different times throughout the day is to evaluate your cortisol at certain times of the day. So we can get a rhythm. I'll show you this on this page for your adrenal glands. You can actually see when you wake up a couple hours later, and as the day goes on, progresses towards the evening, you can see where your cortisol is at throughout the day. We'll also see your total metabolized cortisol, things like that related to pituitary gland, adrenal gland function, and your fight or flight mechanism. The last page of the Dutch Complete, anyways, shows us organic acids, and there's so many different helpful things that come from this, which relate to your vitamin B12, B6, glutathione markers, dopamine, norepinephrine, and epinephrine, even melatonin it'll check, and oxidative stress. This is your organic acid side of things. Super helpful information. And a couple things to note, if you're a woman, you want to try to do this if you have a 28-day cycle between days 19 and 22. If you have a shorter cycle, say a couple days, 26-day cycle, you'll do it between days 17 and 20. You'll just shrink that window by a couple days. If you have a longer cycle, add a day or two or however much longer your cycle is to that window of time, 19 to 22. It'll help us get the progesterone levels more accurately, and for women, you have to be concerned about that and do that. If you have irregular cycles, you're on birth control, you're pregnant or breastfeeding, just reach out and see with your practitioner or myself if this test is right for you and any logistical things related to that. For men, thankfully you don't have to worry about that. If you're postmenopausal and you don't have a cycle anymore, you don't have to worry about that either. There are so much good information on this. I just want to finish here by making sure you know how to fill out your requisition form. There are women's sections, so make sure you don't miss that. If you're on hormone replacement therapy or taking prescriptions, make sure to put that in there. You're also going to put on here, as well as on the card itself, the date and time you did your samples. Don't forget, there's a back page with information that you can share with your practitioner that will really help them understand what's going on as well. So make sure to fill out the requisition form as well as you're able. Fill out each of your cards. Put them back in after you pee on them. You're going to have a little portion here that you're going to pee on. Let it air out before you and dry before you put it back in the envelope it comes in. You're going to put it back in your test kit, and you're going to get this prepaid envelope that you're going to put everything in. Don't forget your requisition form, and send it to the lab. It usually takes 10 business days or less to have the lab do all of its results, and send it to your practitioner. And hopefully they will go over it with you really well. I know I do. We set up hour-long consults after the test results come in. We get you the test results so you can see them, and we go over them thoroughly with you and how to help balance your hormones naturally and hopefully not rely on medications and get you feeling good again, vibrant, healthy, energy, everything that balanced hormones gives you. I hope this video helps you. Have a good day.